Hello people, namaste, welcome back to my channel. In this video I will discuss about the another chapter from forensic medicine. That chapter is infant's death. Infant death is an important chapter for university exams. They have so many questions, important questions for university exams. First I will discuss some. Um, what is infanticide, feticide, filicide, and stillbirth. All this I will discuss in this video. See, first, in what is the meaning of infanticide? Infanticide means depth. See, killing of the child under age of 1 year, and this is an unlawful killing of the child. The age of the child is less than 1 year. It is called infanticide. If infanticide is equal to murder, generally murder in the case of 300 302 IPC section. So infanticide is also similar as taken as section under murder only. Killing of children less than 1 year of age. Next, feticide, killing of fetus at any time prior to birth. Before birth, we are uh, killing the fetus is known as feticide. Filicide means killing of child by parents is known as filicide. Next, neonaticide is killing of newborn within 24 hours of birth. Within after the birth, some parents know if the child is girl within 24 hours, they are killing the child. That is called neonaticide. So I will discuss. See, first of all, before birth is feticide. By killing by the parents is called filicide. We called as feticide, and by killed by parents is called filicide. After the birth, within 24 hours, by knowing the gender or anything, within 24 hours is known as neonaticide. After 1 year, less than 1 year, killing of children less than 1 year is known as infanticide. So this is the differences between feticide, neonaticide, and infanticide. Okay. Next, what is how can we know the stillbirth, live birth, or dead birth? See, what is meaning of stillbirth? Child born after 28 weeks of gestation, which does not show any signs of life at the time of birth after being completely born. Generally, the viability of the pregnancy is greater than or equal to 28 weeks only. Greater than or equal to 28 weeks. See, stillbirth, child is born after the 28 weeks, means viability is present, but which does not show any signs of life. Does not show any signs of life at any time after being completely born. After 28 weeks of gestation, when we take out the baby out, there is no signs of life. That is called stillbirth. See, generally the baby is alive in intrauterine life, but during the process of delivery, the child is died. So it is called stillbirth. The child is still alive in intrauterine life at the 28 weeks, greater than or equal to 28 weeks, while doing the process of while die during the process of this delivery. It is called stillbirth. Causes of stillbirth. Prematurity is the most common cause of stillbirth. Means in premature conditions of the baby, it leads to cause of stillbirth. If any anoxia like trauma, intracranial hypertension, placental abnormalities leads to death of the baby. Toxemia of pregnancy, erythroblastosis fetalis, and prolonged labor also causes death of the baby. This is called stillbirth. Stillbirth examples you should most common is first common is prematurity. Next, any trauma or intracranial hypertension, and erythroblastis fetalis, prolonged labor, placental abnormalities. These are the causes of stillbirth. Next, what is the meaning of dead born? Dead born means the child one which died in uterus, already died in uterus, which does not show any sign after being completely born. But in stillborn, they are alive in intrauterine life. But in deadborn, they are already died in uterus. After there is no signs are also present after being born. What in deadborn? How can we tell the baby is a deadborn? we can see the rigor mortis, we can see maceration signs, we can see mummification signs. So postmortem signs of dead bone are rigor mortis at delivery, and maceration signs and mummification signs are present. So first postmortem sign in dead bone is rigor mortis. You know already what is the meaning of rigor mortis. Next we should discuss about the maceration and mummification. What is the process of maceration? Maceration is the process of aseptic autolysis. Means uh, in aseptic conditions undergoes autolysis. Autolysis which happens when fetus died in uterus and remain in uterus for 3 to 4 days. If the baby is died, if the baby is dead already in uterus, but if the baby is dead, if the time like 3 to 4 days, after 3 to 4 days it undergoes aseptic autolysis. This is called maceration. Why after 3 to 4 days it undergoes aseptic autolysis means the surrounding generally this of dead fetus is surrounded by the liquid amnion, exclusion of air. This liquid amnion, because of this liquid amnion undergoes autolysis, but exclusion of air, no air is present in this surrounding fetus. It undergoes aseptic autolysis, so it is called maceration. So you should define maceration means it is a process of aseptic autolysis. First point, process of aseptic autolysis. Next, it happens when fetus is died in the intrauterine life, and it continues the death in 3 to 4 days of 3 to 4 days died in the uterus. Because it is surrounded by the liquor amnion and no air is also present, no exclusion of air. It is known as maceration. See, in maceration, after first 24 hours, first 12 hours, after 24 hours, after 2 days, what happened? In first 12 hours of maceration, skin undergoes reddening and peeling. Reddening of skin with peeling will occur in 24 hours. In 12 hours. In 24 hours, large blebs are present. Abdominal bolting is also present. What present? In 24 hours, blebs, large blebs and abdominal bolting is present. Next, after 2 days, softening and flaccid of the baby, and baby is soft and flaccid, hypermobile joints and flat baby, sweetish disagreeable smell is present. So you should remember the what is definition of maceration and what are the signs. At 12 hours we can see the peeling, reddening of skin with peeling. In 24 hours we can see the large blebs with large blebs along with abdominal bolting. After 2 to 3 days the baby undergoes flat baby, and what is that, hypermobile joints and soft and flaccid baby, flat baby, hypermobile joints along with the sweetish discoloration of smell will present after 2 days. Next, what is mummification? The fetus died from deficiency of blood supply. When there is no blood supply, it undergoes mummification. When the liquor amnion is scanty, there is no liquor amnion, it undergoes mummification. When the no air enters into the uterus, it undergoes mummification. These are the three main causes. It leads to mummification. What it undergoes mummification? The fetus died because of no blood supply, no liquor amnion, no air enters into the uterus. So these are the red bone signs. Red bone post-mortem signs. In radiological signs are also present. These are the important radiological signs. First we can see the Robert sign. Robert sign means gas shadows seen in the chambers of heart and aorta. When the X-ray radiological signs, we can see the Robert sign. In the generally in aorta and heart having blood should be present, but there is air is present. It is called Robert sign. Because see, deficient of blood supply is there, no blood is present, only air is present, it is called Robert sign. It is the earliest sign within 24 hours. Within 24 hours we can see the Robert sign. Next, overcrowding of ribs. Ribs undergoes overcrowding, okay, due to collapse of lung, because lung will no air is not present in the lungs, so it leads to overcrowding of ribs. Next, ball signs. Ball sign means hyperflexion of spine due to vertebral collapse. Spine undergoes hyperflexion of spine due to vertebral collapse. Vertebral undergoes collapse, so it hyperflexion of spine, it is called ball sign. Next, Dewey's halo sign. Dual halo sign means separation of skull from the skull and wall due to edema. Separation of scalp undergoes separated from the skull vault. Separation of skull from the skull vault is called dual halo sign. Next, paneling sign is important. Loss of alignment and overcrowding of bones of the cranial vault due to shrinkage of cerebrum after the death of fetus. When the cerebrum undergoes shrinkage, because of the shrinkage of cerebrum, it leads to overcrowding of bones of cranial vault. Alignment undergoes loss of alignment and overcrowding of cranial walls. Overcrowding of bones of cranial walls due to shrinkage of cerebrum after death. Sometimes seen in 4 to 7 days, but often later 2 to 3 weeks also present. So these are the radiological signs. These are the important signs. So I will summarize this video. See, listen very carefully. You should know infanticide. See, in this table you should know what is feticide. Before birth, killing the child before birth. After birth, within 24 hours is called neonaticide. Less than 1 hour is called infanticide. Okay. What is stillbirth? What is dead birth? I will stillbirth means it is alive in intrauterine life, but there is no signs after the after being born. Okay. What is the most common causes is prematurity. Prematurity is common, and trauma, ICH, and abnormal placental abnormalities, toxemia of pregnancy, erythroplasia fetalis, and prolonged labor. Prolonged labor is the most common cause also for stillbirth. Next, death birth. Death born is there is in no signs in intrauterine life, and it does not know signs after completely born also. Postmortem signs are rigor mortis, maceration, and mummification. Maceration is aseptic autolysis. Process of aseptic autolysis, it happens when when fetus died, and fetus died in the uterus, and around 2 to 3 days also it completed maceration completed within 2 to 3 days, or 3 to 4 days, around, because it's surrounded by liquor amnia, no air enters into the uterus. In first 12 hours we can see reddening and peeling of skin. Next 24 hours we can see the what hyper bolting and large blebs are present, and after 2 days you can see that hypermobility of joint and soft and flaccid, and flattening of baby, sweetish, disagreeable of smell, all this come. Next, mummification means it when fetus died, why mummification occurs means blood supply not present, liquor amnia not present, no air enters into the uterus. All this leads to mummification. Radiological signs are important. First one is Roberts sign. Generally heart and aorta having blood, but here gas is present. This is the Roberts sign. Next we discussed about the Ball sign, also important. Overcrowding of ribs because of collapsing of the lungs. Ball sign. Ball sign means because of collapse of vertebra, hyperflexion of spine. That one is ball sign. Next, dual halo sign. Halo sign means separation of skull from the skull vault. Due to edema is known as dual halo sign. Next, Swanling sign is important because of collapse of cerebrum. It leads to loss of alignment and overcrowding of bones of the cranial vault. It leads to Spanling sign. So this is the summary of the radiological signs of dead bone. Next video we will know about the live bone signs. Thank you. Please subscribe my channel. Please support us. Thank you.